Before we get started on this diagram, notice that the muscles that are shown on the right side of the model are superficial muscles. They're removed on the left side of this model. When I say left and right here, I'm referring to the model's left and right, not your left and right. On the model's right side, the deltoid is your shoulder muscle. It's like a cap on the shoulder. It allows you to swing your arm back and forth while you walk. Swing your arm a little bit. Think of how this muscle is contracting on the anterior, then the posterior, then the anterior, then the posterior to make those movements. The pectoralis major is the chest muscle. I watched this cartoon Home Movies, which is really like the precursor to Bob's Burgers. And anyway, the soccer coach, McGurk, he starts going to the gym where the biggest pecs win. So his pecs are huge, and he helps a friend move apartments, and he blows out his pecs. Sorry. I also watch Botched. Anybody? I love those too. Breast enhancements are tricky, and they can be done inappropriately if the pectoralis major and minor muscles are not handled correctly. The seating of an implant into the natural pocket made by the muscles is, as I've found out, quite important. All right, most of us know about the biceps brachii here. I just want to point it out on the upper arm. It connects your humerus to your radius primarily. And when it contracts, it brings your lower arm toward your upper arm. Do that. Contract the biceps brachii and replicate that movement. Students tend to get this one wrong on the practical because they forget the brachii. Brachii means arm. Many structures in the arm area, they have brachii somewhere in their name. For example, the brachial plexus, which is the nerve network that feeds the arm. On the left side of this person, we have the pectoralis minor. And notice how the pectoralis major is removed on this side of the model. And you're seeing the muscles that are underneath the pec major. The pectoralis minor is the muscle that naturally lifts breasts. It's also the muscle that is very hard to work out sometimes. You have to do inclined raises to work out this muscle. So on your back, raising your hands directly up, but you have to be lying at an angle or an incline. The serratus anterior is also a muscle that can be tough to work out. It's known as the boxer's muscle. When a boxer does a right or a left sweep, this muscle is used to swing the arm across the chest. Do this motion. Sweep your arm across your chest and feel this muscle with your other hand. Look at how the serratus connects to the ribs. Think of this word also, serratus. It makes this kind of serrated angle as it connects to the rib, and it makes you think of a serrated knife like a steak knife. So look at how the borders of this muscle make a serrated edge. Let's work from the inside out or deep to superficial on these abdominal muscles. You have to think of these like sheets that cover your guts. And there are 4 of these sheets or 4 of these muscles. And we can know them in the order that they cover your guts from deep to superficial. Or we can look at the direction of the muscle fibers to understand their names. First, you have to know that any picture of these abdominal muscles will be cut in some way to reveal all of the muscles. The transverse abdominis is like an apron that covers your guts. And the fibers in the transverse abdominis, they run transversely or from side to side. This is a muscle that's really hard to work out, but it's also the most important muscle in developing core muscles. In order to get it to contract, you have to get like a lateral contraction. This muscle is cut in a C-section birth, which compromises the fibers. And for some women, this can cause everlasting issues if the fibers don't heal well. The internal oblique and the rectus abdominis, They kind of form the next layer together. The rectus abdominis has fibers that run superior to inferior, giving it the name rectus, that means straight. It's the development of this muscle that gives you the six-pack abs. And to work this muscle out, you have to do crunches upon crunches upon crunches, contracting this muscle. The rectus abdominis, it runs along the midline of the body, or the sagittal line. Laterally, on either side of the rectus abdominis, is the internal oblique. The fibers on the internal oblique, they run from the hip up and over until they intersect with the rectus abdominis. This picture is terrible. It barely shows the internal oblique. The external oblique is the most superficial sheet over the abdomen. And this muscle is present on both sides in this picture here. In fact, on this model's right side, the external oblique is almost completely intact, showing you how it covers everything, even the rectus abdominis. On the left side, notice the external oblique is actually cut to show you the rectus. The external oblique has fibers that run from the side of the body down and over. I can never remember which fibers go which way. I usually have to examine the diagram to get it right because I constantly forget the association. So this is what I do. The serratus anterior is up here. And I'm well acquainted with this boxer's muscle that allows you to move your arm across your chest. I can always recognize that one. The external oblique meets the serratus anterior. And the external oblique has fibers that go the same way as the serratus anterior. So these muscles seem easier, but they're not. It's the picture that you have to examine really closely. In the lab, it's the same thing with the muscle models. We have this muscle of a little man, and the external oblique is completely removed on one side of him, and then it's totally there on the other side. And you kind of have to, you have to note that before you even start to look at the muscles on the little man muscle model. So it's the same thing with pictures and models. You have the same kind of association issue. These are the muscles of the back, and for some reason students get all mixed up on these, especially the ones that connect with the scapula. And I think it's because of the nature of the models and the pictures. Notice how the trapezius and the deltoid are intact on the left side of this model, but they're removed from the right side, showing muscles that would be deep to the trapezius. So let's start on the left side with a muscle we've seen before, the trapezius. Remember, it's removed on the right. Look at how it connects the spine to the neck and then to the shoulder. This muscle can cause lots of movements for your neck. Although not difficult to work out, you definitely need to do various movements to work this muscle, much like the various movements that are needed for the ab muscles. The latissimus dorsi is this big sheet-like muscle that basically covers your sides. Sorry. People who do rowing use this muscle. And notice how it attaches the lower back to the arm. The contractions of this muscle not only pull the arm backward, but create a very large backward force that's used in rowing. I have a spinal cord stimulator that was implanted into the sheet-like tendon of this muscle in my back. On the right side of this picture are three easily confused muscles. The levator scapula is not shown on many muscle models, but we get some good pictures of it here in diagrams like this. This muscle, the levator scapula, connects your cervical vertebrae to the superior angle of the scapula. It elevates the scapula when it contracts, giving it its name. So raise your arm upward, and you're elevating your scapula to do that. The rhomboids are so named for their shape, with the major being inferior to the minor. These do something similar to the levator scapula, connecting the thoracic vertebra to the vertebral border of the scapula. Think of how your scapula could move with the contraction of each of these muscles. This is why shoulder movements are so complex, and this is why healing of shoulder injuries is also very complex. This is a great but confusing picture. It's also a great reminder of one of the most common things students say about the muscle practical: I should have looked at more models. Unlike the bone practical, where you can look at diagrams and learn the bone features, it's not really all that possible for the muscle practical. And like the bone practical, the muscle practical has pictures of real muscle models. With these types of models, it's necessary to know a little bit about the model. So what I mean is knowing that the right side of this model, meaning the model's right side, the external oblique is intact. But on the left side of this model, it's been removed. I can see that because the rectus abdominis is superficial and not covered by the external oblique on this model's left side, which it should be. But the external oblique is covering the rectus abdominis on the right side. Knowing that models like this will commonly remove superficial coverings on the left side, but leave superficial coverings on the right side, is essential to learning the muscles, whether you're in person or online. Knowing this would also prevent you from making the mistake of thinking that the internal oblique is actually the external oblique. This is also a great picture because we don't have this specific model with the arm raised in our labs on campus. And the value of pictures like this is that it combines muscles that are anterior and muscles that are posterior onto one picture.